So, when you start your language assessment, you should know the handedness of the person. The hemispheric dominance and handedness are connected. In right-handed people, 90 to 96% of the right-handed have a left hemispheric dominance, right hand left hemispheric dominance. In those of the left-handed individuals, 60% of them still do have a left hemispheric dominance and about 40% of them have a right hemispheric dominance. This is very important in assessment because you see that handedness and hemispheric dominance tests have to be done to understand where is the language area. So, agility of performance of tests will all depend on the handedness. If you give a keyhole and ask a patient to see, you can see the eye-headness, whether the person is looking with the right eye or with the left eye. Leg-headness by hitting a ball, drawing concentric circles with right hand or left hand, dichotic listening with the binaural stimuli. And then EEG can show some asymmetry and CT also can show asymmetry. Let us see how do we test this. Apart from asking the patient which is your dominant hand, he or she may be able to tell it. Which hand do you use to hold a spoon or fork or knife? Then they will tell right hand or left hand. Then to throw a ball, stir coffee, and whether there is any family history of left-handedness or ambidextrity where persons can use both their hands well. So, functions of the right hemisphere, why did I go into that? Because functions of the right hemisphere will be the prosody, nuances and corticocerebellar connections. The prosody is ups and downs in our speech and that is very, very important. The components of speech and language will be the phoneme, the syntax and the semantics. You know, all high sounding words. Let us see what it is. Phoneme is a small use of a sound like B in bat, ba. Usually the children are taught B says ba, P says pa. That is a phoneme. Phonology is the sounds that compose the language and the rules that govern how they are combination. Like when you say B in bat and but is different. So, it all depends on how it is combined. Syntax is permitted combination of words. So, phrases, grammar, sentences, etc. Semantics is the meaning of words and word combinations. Lexicon is our internal dictionary. Phoneme is the smallest unit of sound. Phonology is a combination of how those sounds can be made. Syntax is a combination of words. Semantics is the meaning of words and lexicon is an internal dictionary. Prosody is the intonation of speech or sound and of utterances. It can be used in two ways. Oh, you have come with a smile. Then, oh, you are welcome. Oh, you have come. That means you are not welcome. So, it will all depend on how we are using it. It can be the same words, but the way we give stress on certain words and the tone with which we speak will give it a lot of meaning. For this, you definitely have to understand the language. If you are going to talk to somebody else in a new language, then you may not be able to understand the small changes in the speech pattern. Narrative is ability to construct or understand a storyline or anything, to tell a story well, to give you a history in a very coherent pattern. Inference is the ability to fill in the blanks. Suppose I say, look, I was sick, so office, so I was not able to come to office. Pragmatics refers to the proper use of speech and language in conversational setting, including the pausing while others are speaking, taking turns properly and responding to questions. And this never happens in many of the TV debates. As you can see, all of them will be speaking at the same time. Discourse refers to the use of these elements to create an organized and logical expression of thought. That is, when somebody is speaking to you in a very well prepared manner, then you know that's organized and logical expression of thoughts. So, why should we assess speech? Because different types of speech have different outcomes. Is speech output present? If it is reduced, is it aphasia, dysarthria or apraxia? What is it? Aphasia is difficulty in speaking or understanding. Dysarthria is difficulty in expressing, much more because of the lower muscular problems. Apraxia is inability to speak even though everything is alright. There is no weakness. Is there a dysprosody? Sometimes people will keep speaking monotonously without any pauses and all that. Then that is dysprosody. Are there any evidence of specific aphasic disorders? Errors of syntax, word filling pauses, abnormal words or paraphasias. Instead of her, if I say burr, then it may or may not have any meaning depending on the context. That may be taken as a paraphasia. We look at all that in detail. When we assess the language, we assess these 8 aspects of it: spontaneous speech, verbal fluency, comprehension, repetition, naming, reading, writing and spelling. Spontaneous speech, what is the person speaking, how fast or slow, what is the content of the speech. And verbal fluency, is it very slow, hesitant speech or is speaking very fast. Comprehension is to understand what is said and also sometimes what is said between the lines. Repetitions, whether the person is able to repeat what you are telling. Name the objects properly. Read and understand. Write and understand, and also the spelling. Knowing the handedness of the patient should be a pre-language assessment, because the language will vary depending on whether you are right-handed or left-handed person.